This is Local Edition. I'm Brad Pomerance in Sacramento. Today we are joined by Matt Cate. He is the Executive Director of the California State Association of Counties, which is involved in an issue that at first glance we wouldn't think that you'd be involved, but it's very important for the 58 counties, and it deals with in-home supportive services. What are in-home supportive services?
Well, so this is these are the folks who provide care to the disabled or to people who are having a hard time functioning in and around the community in their homes. So the concern had been that too many of our elderly, too many of our disabled were ending up in long-term care homes. Nursing homes were packed. The state pays the freight. And so it was both expensive and ineffective. So they weren't thriving in some of these nursing homes. And the idea was, if we can have someone provide care in their house, maybe we can avoid these expensive long-term care facilities.
Yeah, and you said it. Essentially, it's not only beneficial to the patient, but there is an economic advantage to have folks not be institutionalized. But obviously, these individuals need assistance, and so certain folks will be hired. Could be a family member, could be an outsider, and that system seems to have been effective and efficient. Is that accurate, sir?
Yeah, I think that the growth pattern of people being institutionalized went down. We bent the curve, as they say.
Sure.
And we certainly have heard over and over again how much it means for the elderly and disabled to be able to live out their years in their home for as long as possible and to be cared for by a loved one who otherwise would have to work outside the home and couldn't do those services. So I think it's been seen from the county perspective as a success.
Now, as I understand it, prior to 2012, there was a funding formula in place, and the federal government would pay 50% of the costs, and then the state would pay 50%, but the state then created its own formula for that 50%. 65% would be paid for by the state and 35% by the counties. But 2012 was a pivotal year for this program. What happened, sir?
Well, in 2012, the legislature began to think about how do we provide care to these people who have the greatest need. And the idea was, if we can coordinate the care that's being provided by their in-home supportive services worker and their doctor and other medical providers into a coordinated care initiative, or CCI, as we love our acronyms in Sacramento.
Of course we do.
So, but a coordinated care approach might reduce the costs of running the program because...
As I understand it, I'm sorry to interrupt, but a lot of folks that were getting in-home supportive services were what's known as dual eligibles. They were also benefiting from Medi-Cal, Medicaid, and these programs were acting independent of each other, and under CCI,
we brought them together so they would coordinate with one another. And ideally, you would make sure the person had what we call a health home, right? A place for me and my family, that's Kaiser, but maybe it's something different for their family. But a place where they could go to get health care that would be coordinated with the work that was being done in the provision of care in their homes, and so that together would draw down these expensive emergency room visits and expensive price per visit kind of doctors.
And so how did the funding formula shift under this new regime?
Well, the idea was that counties would continue to pay our share, but our share could only grow by 3.5% a year.
I see.
So the growth of the program was doing a little more than that, but our share was limited to that amount of growth. And that's regardless of what happened at the state level. So we were still paying our share, but our growth was capped. And so that gave us some security because the state was going to take over negotiations with the labor unions who represent the people providing this care.
Right.
And obviously for counties, if we aren't negotiating and we can't control the costs, we shouldn't have to pay the brunt of paying all those fees. And the state was going to pay for their new obligations through the savings from the Coordinated Care Initiative.
And how has that worked over the last 4 or 5 years?
From our perspective, it's been successful. You know, a lot has to go into getting individual people in their homes to agree to change doctors, for example, to a doctor who agrees to be a part of this Coordinated Care Initiative. And in some communities, those folks didn't want to move. And maybe it's because they like their doc, or their doctor said, oh, you don't want to do that. So the state didn't save as much as they had hoped.
And that's the key, because under the 2012 initiative, or law, I guess you could say, there was what's known as a poison pill. Is that accurate, sir?
That's right.
And what did that poison pill say?
That language said if the Coordinated Care Initiative doesn't save an amount of money equal to our additional costs, then the Department of Finance director will notify the legislature and the governor of that, and the program will be this new cost sharing and this new use of the CCI will be undone.
Do we go back to the 65-35 split?
Yes, and so that happened on January 10th.
Okay.
Director Cohen sent a letter to the legislature and notified the governor and counties that his staff had found the program was saving insufficient dollars, and so he pulled the trigger, as they say, and immediately counties began to have to do their own bargaining again, and then as of July 1st, the cost sharing reverts back to the way it was in 2012.
And as I understand it, this is causing counties a lot of heartburn, because in the interim, in the 5 years that intervened, what we saw was an increase in the minimum wage in California. We saw an increase, or the addition of paid sick leave, and then new federal overtime regulations. So those kick in and you don't get the benefit of the 3.5% cap.
Right.
Am I saying it correctly?
That's right.
So talk me through this.
So from the county perspective, we gave over a program that was the size of a small dog, and we're
Right.
getting back St. Bernard.
And how much could this hit counties? I understand the numbers are quite large.
Quite large. So between the growth in minimum wage and 3 days of paid sick leave for in-home supportive services workers, the state had cut 7% of their hours, so reducing the cost 7%. That was reinstated, so they're now eligible for their full hours. And the Obama administration basically said you can't limit overtime, and so push all that together over the course of 5 years, that's $500 million.
Maybe
and
more.
Once minimum wage grows up to $15 an hour, it's $1 billion with a
Wow.
B every year forever.
So in our final moments, what are the counties doing?
Well, we're going to meet with the governor and ask him to change his mind.
Right.
We've been great partners. The governor's been great to counties. He cares about implementation of state programs at the county level. He's been fantastic to us. I think we've been a good partner to him. We're just going to try to explain. We need to work something out.
You'll come back and we'll talk more about this?
Yes.
Okay. He is Matt Cate. He is the Executive Director of the California State Association of Counties. I'm Brad Pomerance in Sacramento, local edition.